Let's talk a little bit about, I know you have a model here with you. Let's talk about some of the incisions that are made here on the ankle and what would be standard operating procedure for you as you're looking at certain ailments and certain physical needs of the ankle when you're dealing with it either arthroscopically or full surgically.
Right, so arthroscopically, once again, we typically will use 2, sometimes 3 incisions, and they'd be a small incision here, another one here, okay? And then at times, you would actually have a small one in the back of the ankle. Some of these other procedures, let's say that we're doing, let's say we're fixing an ankle fracture, right? We'll sometimes use a small incision here and be able to fix a fracture through like a small rod or a small nail, let's say, where traditionally we may have to use a plate. Bunion surgery, instead of having to cut the bone in this way, we cut it here and realign it through a very tiny incision, right? So there are many different procedures that we're doing that we can get through with different incisions now.
My grandfather was a tool guy, an electrician. I am fascinated by tools every single day, and you have one right there at your left hand. Tell us what that is.
Right. Well, this is traditionally like what's called a suture passer. And I shouldn't say traditionally because we're using these in different ways now. So once again, this is being able to either pass a stitch, right, through a small incision, and it may even be off site, meaning like, let's say you're fixing the Achilles, right, the Achilles tendon, which attaches here to the back of the heel bone. Rather than making a larger incision up here, we make a very small incision, be able to pass this tool in to retrieve the suture and bringing out through a small incision here. But once again, without a tool like this, it would be impossible to do, or let's say you wouldn't even think about being able to do it. So having certain tools that are shaped in a certain way to be able to get around the anatomy is very important.